Polling data from Pew Research shows that during both the 2018 midterm elections and the presidential election later this year, healthcare is the top concern for voters. And looking at the numbers, it's easy to understand why. Census data reveals almost 28 million Americans were uninsured in 2018. And the Commonwealth Fund, a non-profit focused on affordable healthcare, found that same year just under 10 million Americans were underinsured. That leaves a lot of Americans living in a precarious situation should a medical emergency arise, with many second-guessing a visit to the doctor. A study by the University of Chicago found that in 2018, over 40% of Americans decided to skip out on receiving care. Experts blame it on the high costs of healthcare. It's not that the US isn't investing enough in the area. A report by the Organization for Economic Cooperation and Development found in 2019 it spent more than $10,000 per person on healthcare costs. To put that into perspective, fellow OECD member Canada only spent about a third of that. Yet, here's the thing. The main reason for declaring personal bankruptcy is high medical expenses, while in Canada it's the least common cause due to the country's universal healthcare system. The costs weigh heavily in more ways than one, with possibly tens of thousands of Americans dying every year due to a lack of insurance. The most cited article, published in the American Journal of Public Health in 2009, estimated almost 45,000 people die this way annually. So, who's to blame for the high costs and the general lack of coverage? Experts cite everything from high administrative fees to the greed of insurance companies. But whoever or whatever is behind it, the American healthcare system is one which puts the lives of millions in the balance. Daniel Bay, CGTN.